We began this crisis without a true healthcare system. We had a hodgepodge of public and private institutions, rich hospitals, poor hospitals, city, state, and federal agencies who were all on different pages and not working in any seriously unified way to deal with what we needed. In New York State, we started out this crisis with 20,000 less hospital beds than we had 20 years ago, along with less doctors and nurses to staff those beds. This non-system failed to stockpile, produce, and otherwise procure the very basic tools that we needed to protect ourselves. We are still recovering from the trauma of this war. The dead patients we've seen, the impact on our families, the co-workers and loved ones that we've lost. And yet a profound insult has just gotten added to our numerous injuries. After all we've given to this fight, this is simply a brutal slap in the face for our efforts in this war. But if this is how we're going to continue to be treated after all we've been through, how do we expect to meet any serious public health care challenge in the future?
We do have a policy for years. You need to have a doctor's note after 3 days. In the middle of a crisis, in the middle of a pandemic where we're fighting for our lives, they changed the policy. Are you kidding me? Huh? We are trying to save people's lives, and while we're putting our lives in danger, our families, our loved ones, and they try to change the policy in the middle of a pandemic. This is outrageous. Trying to tell us we need a doctor's note when we can go to the doctor. Huh? How are we going to get it?
I've been a nurse at Jacobi for approximately 7 years. My biggest issue is I am now COVID positive. After feeling my symptoms, I came to my hospital to ask to get tested and was refused testing for a whole 4 days. I literally drove over the bridge to come here and had to beg my management to test me, and they refused to do so. Initially, after 4 days of fighting, I got tested. As I got swabbed in my institution, before my specimen was labeled and sent off, I was told I am afebrile, wear a mask, and go back to work. My specimen has not even received the lab for testing at that point. This is unacceptable, and this is why we're spreading, and this is why we're in a pandemic. Sure enough, 3 days later, I got the result of being COVID positive. I am weak. I can't get out of bed, but I was still told to come back. It took me 2.5 hours to get a mask, and I had to say, listen, people, I am positive, I am here, and I was told that once I got this mask, I could not get another mask for another week. This was as up until yesterday, that was information given to me. So me being positive, still coughing, going around my patients, I have one soiled mask that I'm now able to use for the next week until next week, Thursday, before I will be issued a new mask. How is this acceptable in America? Please, someone let me know. It's unfair to see us suffering when we could be saving lives based on the fact of just giving us the correct equipment that we need so we could keep on this good fight. Thank you.
I've been here for almost 39 years, going on 40 years. I shouldn't be told I cannot come to call out sick because I don't have a doctor's note.
The president is saying we have enough PPE. We do not. We have to fight and sign for every single PPE we have, from gloves to this thing I'm wearing over, the paper scrubs. And then when you come, they don't have your size, and you have to come back. Deciding for wipes to go out on your area, and it's a fight. Come on. We shouldn't have to be living like this. This is